Good morning. Our meeting call to order. I am so happy to see all of you in here. It appears we have a quorum, and thank you for the guests who have come to enjoy this morning with us. It's a packed agenda, and I'm delighted to have you all here. I am Joanne Ruth. I am the chairperson of this Regional Advisory Council. I represent Colorado Springs, and why don't we go around the room? Which way should we go? Margaret, why don't you start?
I'm Margaret Hunter, Colorado Springs and the Myron Stratton Home.
Good morning, I'm Cheryl Schnell, and I work with Department of Services.
I might remind everybody, hit your button on your mic if it's not on to make it blue, and that'll allow you to be recorded properly.
Thank you.
Hit the blue button.
To make it blue.
Oh, there you go.
I'm Phyllis Huggins, Eastern El Paso County.
Harry Schillinger, Area Agency on Aging.
Dave Betzler, Northern El Paso County.
Betsy Anderson, Keller County.
Aisha Young, Fountain, Colorado.
Fran St. Germain, El Paso County.
Carol Parks, Teller County.
Carolyn Massey, Colorado Springs.
Wendy Farr, Rocky Mountain Healthcare Services, but a member at large for Colorado Springs.
Thank you.
Joe Urban, Area Agency on Aging.
Thank you. And let's introduce our audience. Start wherever you want.
David.
Hi, I'm Dave Bonner with Next Day Access.
I'm Emma Schistel, Innovations in Aging. I'm Claire Anderson with Innovations in Aging.
Good morning.
I'm Debbie Curran, PPACG AAA Accounting.
Lisa Aldridge, PPACG AAA. Mary Pat Gallus, Consortium for Older Adult Wellness.
Kathy Lowry, Teller Senior Coalition.
Ralph Powers, Teller Senior Coalition.
Miranda Schott, UCCS Aging Center.
Bobby Gore, Park County Senior Coalition.
Joyce Whittle, Park County Senior Coalition.
Mary Barrowman, Prospect Home Care and Hospice.
Good morning, Mary.
Yeah.
I'm going to go ahead and jump in here. Sorry. Casey, if you'd stand up. This is Casey Partridge, who I'd like to introduce. Casey is our new finance manager for PPACG and AAA programs. Many of you who are familiar with the PPACG know that we split the finance responsibilities of the RTA and the general PPACG/AAA programs. And Casey is now in charge of those programs. I'm going to let her talk briefly. I didn't tell her I was going to let her do this, but we're going to let her tell you a little bit about her background. But she brings a wealth of knowledge to us, and we're real excited to have her.
Can you go to the mic, Casey?
Oh.
And then press this gray button when you get there, too, please.
Oh, it's all before.
She didn't know any of this was happening.
Well, good morning, Casey.
We call this an ambush.
Yeah, no kidding. My name is Casey Partridge. I am new here to PPACG. I have been in Colorado before. I moved back from Las Vegas. I was there for 4 years. My history is in nonprofit. I've spent 20 years with different YMCAs, and before that I was with medical facilities and other organizations in California. So I am spending a lot of time reading all the grants, and I've read all the proposals and find it all very interesting, and I'm looking forward to seeing how it all plays out and working with all of you throughout the next few years. So, any questions?
Welcome.
Thank you so much.
Thank you.
This will be a very informative meeting for your We appreciate you being here in Colorado Springs and certainly with us.
Thank you.
Have you had a chance to look at the agenda, and are there any additional items to be added or that anyone sees? Hearing none, we'll approve the agenda. We have public comments, items that are not on the agenda. Seeing none, let's go on to the approval of, sorry.
It's an event that's coming, so should I do it now or later on?
At the end for community information.
Okay, yeah.
Approval of the minutes for the April 28th, 2016 minutes. Have you had an opportunity to review them? Do you see anything we need to attend to?
I move that we approve the minutes.
Seconded.
It's been moved and seconded. All those in favor?
Aye.
Opposed? Thank you. The minutes stand as approved as read. I want to tell you, look, it's 9:99, and this says special presentation at 9:20.
Woohoo!
So here we are. Are you ready?
I'm ready.
Okay.
No pressure.
If you were waiting for the time, it happened.
Claire, aim it up at the projector if it doesn't come on. It's a little sensitive.
It takes a little bit of time.
There you go.
Looks like it's coming there.
It's coming up.
Good. Good morning, everybody.
Morning.
Morning. I'm Claire Anderson. I'm Executive Director of Innovations in Aging. Thanks for having us back again this morning. It's nice to see everybody. I just wanted to give you a quick update about where we are on age-friendly Colorado Springs since the last time I was here to talk to you all. And I think it's been about 8 weeks since I was here last, and it's been a really, really, really busy but great 8 weeks. And we've really moved along quickly through the process of writing the plan for age-friendly Colorado Springs, and now we're moving into implementation. So I want to tell you about two things. I want to tell you about implementation first, and I also want to talk to you about a community survey that we are doing as well. So let me tell you about our implementation plan first. So last time I was here, I told you about the subcommittees for the 8 domains of livability that we were putting together, and we're going to do the work on this plan to create 3 to 5 actionable goals for each of those domains. Those groups met for about 6, 7-ish weeks, and each group has 3 or more, I would say probably more than that, goals for the next 3 years to become as age-friendly a city as we can be in those 8 areas. So the groups, the committee chairs of each group presented those goals to each other last week so that each of the different committees could see what the other committees were working on and what their goals were. And now the time has come for Emma and I to put all that information together and actually write the plan, which is very exciting. The planning process and the discussions and the work that was done over the last 8 weeks was really, really excellent and really fun and just really fascinating conversations, and I think we feel really lucky to have been a part of those discussions. But now, Emma and I have been working to put all this information together. You all know Emma, I'm sure, right? I didn't realize that should have mentioned Emma earlier. So we're putting together all this information into one large report, which we hope to have done by the end of June. And then our next task is to present that to Mayor Suthers for his approval, as well as to the Innovations in Aging Board of Directors. And then we can submit that report to AARP and the World Health Organization. And from what we understand, the turnaround time is normally pretty quick to get that back. But they will review the report, send us any questions, corrections, additions, things that they want to see in the report. And we will work with them over the rest of the summer to complete that report so that it's ready to present to the public in the fall. September 8th is our launch date that we're working towards, and I will send you all more information about that as well. But if you want to keep September 8th on your calendar, we'll have an official launch for Age Friendly that day. So the task of Innovations in Aging now is to determine the right way to implement the goals. And once we kind of get things a little bit more compiled, I would love to send you all that compilation of all the goals and objectives, the action items under each of those areas, so you all can take a look at that and see what we're talking about. because what we want to do is we want to identify the low-hanging fruit. We want to identify the crossover and the ways that we can pretty quickly implement some of these important objectives and the ones that are most easily doable. So the Innovations in Aging Board of Directors will take the lead on identifying which ones we should start out with. Keep in mind it is a 3-year time frame, but I think that we want to be pretty judicious about getting on these action items quickly so that we don't lose the momentum that we've gained over the last couple of weeks.
Claire, just one question.
Yeah.
Do you have other plans to look at from other communities as well to sort of help guide the process? Okay.
We do. The nice thing is that through AARP we have access to all 70-ish of the other cities' plans. There's a couple that we think are really great. We think Portland, Honolulu, Washington, D.C., and Cleveland are just the most kind of user-friendly and easily readable and easily understandable and just really nicely laid out. So we've been using those as sort of templates and sort of guides for our work. Yeah. We do want to do some focus groups with the senior center, some Y locations, some library locations, and I think that we will come to you all as well to see if there's some small groups that we can get together, and those folks can take a look at the goals and also help us identify which ones of the goals should be immediate for us. Innovations in Aging will take the lead on seeking funding to implement these goals, and also to seek appropriate community partners for implementation of each of the goals. And I think that Innovations is really lucky to have so many great community partners. And I think that along the way through this process, different organizations and individuals have stepped up and said, you know, this is a great goal for our organization, and we'd love to work with Innovations to take this on. Sure, go ahead. So if you all, when we kind of compile this information and send it out to you, if there's a goal that sort of rings a bell to you, or you think that this would be a great goal for your organization, we'd love to talk to you about that and see if there's a way that we could partner on it. Once the report is complete and has been given the okay by AARP, we'd love to also have your help in disseminating the report. And then, like I said, mark your calendars for September 8th, and that will be the launch event for Age Friendly. So and I don't know if Carrie emailed it to you, maybe, the link to the survey. Excellent. So in your materials, there was a link to the Age Friendly Community Survey.
I sent it actually earlier than the survey, than the packet.
Perfect. Thank you so much. So if you haven't had a chance to take that yet, we'd love to have you all take that, and we have paper copies, too, of that, if that's something that you'd like to take some paper copies around to your organizations. AARP will be emailing that survey to their members in Colorado Springs, which is about 5,000 folks. We've completed the survey at the Senior Center, at a couple Golden Circle Nutrition sites, some Y locations, and a couple of the library locations as well. Our goal is just to get a kind of general idea of the age friendliness of Colorado Springs. So far, I think that it's been kind of all across the board. We've had some folks, we asked questions about how close do you live to a bus stop? How important is you to remain in your home as you age? How often do you interact with friends and family? How do you get community information? Things like that, questions like that. And so I think we've seen a whole variety of answers so far and gotten lots of great feedback. Yes, ma'am.
How many respondents have you collected from so far? 109. Awesome. I will resend that link right now.
Great.
And encourage everyone to pass it on to anybody else that they think would like to take the survey. You don't have to be a senior to take it. You're still entitled to have an opinion.
That's exactly right.
Yeah.
Right.
Oh, yeah, we might, I might send it to my prospect over there.
Sorry, everybody else is saying it.
Some people who didn't realize that it is age-friendly Colorado Springs. So I know some of you are from Park County and Teller County, and as of now, the age-friendly project is just for the city. So we did have a couple of complaints about there not being any questions about the Fountain Valley Senior but because that's not in Colorado Springs, that's not in our.
Thank you for that explanation.
Yeah, and
That's
our.
a good point, Emma.
It is. And our hope is that, so in the AARP process, they encourage you to start with one municipality or start with your elected official, and then to kind of branch out from there. So we have started with the city and with Mayor Southers, and our hope is that eventually, kind of once we get some of these things in place, we can branch out into the county. And then maybe someday it can be age-friendly Pikes Peak. Pikes Peak region, exactly. So thank you for taking the survey. Our hope with that is that, we have the Aging in the Pikes Peak region report, which has great demographic data for us, but we hadn't gathered kind of, information from the community and their thoughts on how age-friendly we are as a community, as a city. So that's our hope with that, is that we can get some more information to use in the report and kind of get some ideas about how people are feeling and what their thoughts are about the age friendliness of our city. I think that's it.
Down the wrong way.
Yes.
Is that you just mentioned, aging in the Pikes Peak region? Is that available?
It's on our
for
website.
public consumption?
It is. So our website is innovationsinaging.org, and it's right on our website under research.
And I would like to thank, unfortunately, Marilyn just left the room. I was responsible for chairing one of the 8 domains, and I had the pleasure of having Joe Ruth and Marilyn Massey, as well as this character you may remember if you've been on the rack a while, Bill Gamble, serving on my committee. And I am very glad that they were willing to put up with me in addition to rack meetings at those domain meetings, because their contributions were meaningful. I mean, I can think I know what a perspective of somebody, 10, 15, 20 years my senior might have, but it's just what I think. It's not real. So it was very helpful to have input and participation and incredible attendance, too, I have to say.
Yes. Yeah. Well, Carrie, thank you so much for your help with that, too, and for chairing the committee. And
Kent Matthews.
Kent Matthews was another committee chair.
Joe served on transportation.
Exactly. And Lisa, right.
I was also on a committee.
She was on Kent's committee, yeah.
Yep. So really, really grateful for your support and your participation in that. It's been really a fun process. Any other questions? Spread the word about the survey. It's easily forwardable. So if you want to forward it on, that would be wonderful. And then folks who who might be AARP members will get it in their email. And if you would encourage them to take it as well.
So is the survey written in such a way that as a professional, we can do it as from our perspective of what we've seen, or is it specific to a senior's perspective?
It's, I think it's more of a personal perspective, I would say, but not specifically senior. I think our youngest respondent is probably 32 or 33, and then 36 and all the way up to in the hundreds. But I would say I would take it from a personal perspective.
It forces you to. Like, there's not really, the questions are very simple and very straightforward, so it's not like a big, oh my gosh, I don't know.
Yeah.
You just.
Right.
Did you send it to the Black Forest AARP chapter?
That's a good question. I don't know if they did or not, but I'll find out. Yes.
It's a good group, and they're pretty active.
Yep.
And I bet they have good input.
You might want to send it to Vicki and tell her.
Yeah, that's great.
And Prospect Home Care and Hospice.
I'm going to write this down when I sit down.
You had no idea.
Perfect.
And you know what, Claire, we'll send it, Lisa will send it to all of our providers because she has them as an email group. So that'll cover Prospect Home Care and Hospice and everybody else in the audience.
Thank
I
you.
see Miranda nodding back there.
Yeah, I think Lisa did, actually. I think she was nice enough to send it already for us, so thank you. Right.
If you need somebody at AARP, the Black Forest chapter, let me know.
Great. Okay,
Or I can just forward it on.
Thank you.
perfect. Thank you. I appreciate that. Thank you. Thanks, you guys.
This is one of the fastest startup projects. I say startup, but from the time of the committee's meeting and going boom, 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 boom for 6, 7 weeks. Oh, my goodness, and we're coming up with a project. So when we're used to spending a couple of years trying to get something off the ground, well, here in Colorado Springs, thanks to this group, it's really happening. So I just want to say an extra thank you to you and Emma and to all of your organization. It's really, really important work that we are all doing together. Thanks.
And I would like to add just one comment. I think some special recognition needs to go to those two folks right there, and in particular Jan Martin, who attended virtually every one of these 60 billion meetings that happened during this process. And it was a huge time commitment. It wasn't a little volunteer effort. It was big.
Seriously, thank you.
Thank you again. Well, speaking of efforts, what you have up on the white on our screen is our big responsibility that makes a huge impact on our Pikes Peak region. And so it is with honor and pleasure and not a large understanding of what it takes to get here. We are ready to look at the funding allocations as determined, recommendations, I should say, as determined by the Technical Review Committee. I sat in on that committee. It was chaired by Dave Besler, and all of our RAC members were invited to attend as they could and wanted to. We had some very solid representation on our board and very committed representation. I sat in on all of the meetings and found them very valuable, interesting, and well-run. And so said with that, Joe, would you like to take over, and then you and Dave have the show?
Actually, yeah, and I'm going to leave a lot of this to Dave since he's the chair of that committee. The one thing that I did want to do in terms of recognition, if you were, I'm going to ask you to stand up if you were part of that committee. The TRS, or Joe as well, who participated in that. The amount of effort in this project is not, it's kind of like what we were just talking about with Innovations in Aging. It's not your average volunteer, I'm going to go work a booth for an afternoon. This requires a huge amount of personal time, sitting alone in a room with a computer looking at RFPs and deciding what's valid, what's most important to the seniors in our region. And the remuneration they get is the amount of applause they get in the next 15 seconds. So I would encourage you to give that to them generously.
Oh, my God.
There's one participant who's not here today, and that's Jerry Novak.
Yeah.
He's
Excellent.
participated 2 or 3 years on that committee.
Thank you for bringing that up. Yeah, Jerry was a very valuable part of that as well.
Right.
I'll
So,
let
just do it from here?
Dave take it off.
I'll just talk from here, I guess. So, again, as an introduction, I'd say that I, from a personal perspective, I sat in on the TRS, I was on the TRS last go-around, and I'm chairing it this year. And I just want to thank each and every one of the members for participating and providing valuable inputs and real thought in looking at and evaluating these proposals and coming up with a rationale for why, for how much and why we come up with the final answer here. So we've met 3 different times. The subcommittee did, supported by the staff in great detail and very, very welcome support. $4.415 million, $4,415,009 was the total amount that was available for spending, and our allocation total, or our recommendations total that same amount.
Dave?
Yeah.
I'm sorry to interrupt for just a second,
Okay.
but the grid on the first page of the memo, the formula must have been incorrect because that total amount should be the amount that Dave just said instead of what it says. And I checked the individual amounts for each of those funding streams. The individual amounts are correct.
Okay. Yeah, the correct numbers are on the screen there.
Yes.
$4,415,009. That's the amount that we, from a subcommittee perspective, have come up with. So the process that we went through, we started off with looking at each of the proposals individually. This is on separate at home, took them home, ran through that, and came up with an initial score sheet, if you will, based on our best understanding of what the words were saying and our understanding and recollection of what the presentations were. So we came in with our initial spreadsheets and then had the meeting and discussed those. And then again, went back and there were some questions that we had asked of a number of the different providers, and the staff went out to get those answers, if you will, for those questions. That information was all captured, if you will, and brought back individually to the members of the subcommittee. And then we met for the last time here and went through line item by line item each of the proposals and said, okay, organization A is asking for X amount, and what's the discussion? How did we believe that their rationale, that their justification was strong? And then we made the allocation decision at that point. How much money we thought that one should receive. There were some that we had questions about them, and I'm not sure exactly the best way to go through this. We can go through line by line. You can take a look at in your handout, you have the spreadsheet, and you can see what we've done on how much was requested and what our recommendation is. Those two columns are probably the most important ones. And then on the notes side, you can see that, okay, there were some questions and some point towards actions on the part of the provider, asking them to provide better information or different information next go around. And also, there were others that were reminders to us for the RAC members just to understand this is how we looked at these individual proposals. So, again, I would just say that it's a pretty intensive process going through this. Betsy and I had a conversation just before the meeting this morning, and I think one of those things that we're considering or should consider going forward is that we get individual snapshots from organizations about what they need. Here's what and their word picture, if you will, or their presentation actually describing what the need is in that particular area. What we as an organization then, and subcommittee specifically, have to try to do is try to figure out, well, okay, these are all these individual pieces coming forward, but are we missing something across the whole area for seniors? Is something in demographics changed? Is there some other thing that's happened that we should be aware of? And also, so that's just one thing we have to think about as we go forward. The other piece really is also that, for the most part, probably 95% of the presentations and the provider requests for funding did it before, we're doing it again. It's a continuation. So when we get a new request, a new start for something, that's awkward for us in the sense of how do we deal with that, trying to rationalize a brand new start, could be a very valuable service, based against all those other needs that have already been funded for a period of time. So we're just trying to grapple with that in our mind to say, well, maybe there needs to be a small percentage of the total amount that might be set aside for new starts, so that we're hitting all the basic needs first, the continued needs and claimants for services. We're meeting those needs, and then there's a small amount that's set aside. So if somebody else has a new idea that came in and said, okay, this is a great idea to support a group of seniors or a different service out there, then that's the money that we'd have available for it. Rather than trying to take money potentially from the regular body of providers that we have, pull some out and say, let's start this new thing over here. So that's just some of the things that we were talking about. And again, I think that the real value of the subcommittee is that you have some very, very bright, capable people, Betsy, Joe, Cheryl, Marilyn, that really make a difference as far as, okay, hey, we're thinking about things in a little bit different perspective. So with that as an overview, I guess, introduction, we can, happy to run through this for anybody. We'll answer any questions that you may have. So,
Dave, if I could interject as well. I think we've talked about this a little bit in the past, but I wanted to reiterate it. The focus and the purpose of the staff interaction in this process is hopefully a neutral component, for lack of a better term. What we try to do is serve as a resource of information for the TRS without unduly influencing them, or without influencing them at all, actually, on any of the decisions that are made. So we give numbers, we give facts, we answer questions, but hopefully don't throw our personal opinions in about what goes on. And I personally am very committed to that, and I think everybody here is very committed to that process of
Right.
of making sure that we maintain the neutrality of it. And that's what makes our process in the Pikes Peak region, I think, so strong, is the fact that it does have that component to it.
Just to piggyback on what Joe said, I think that the importance, too, of the staff, especially Lisa and Debbie, is that for the most part, they've gone to each and every one of the providers. So they have firsthand information about what's actually going on in that service area. And so when we look at the numbers and we look at the written proposal, if we have questions, then we can say, okay, hey, Lisa or Debbie, can you provide us any other additional information on that? So it really is a very strong approach, I think, that's been developed here, with using the staff as the experts that are there, but it's really up to the members of the subcommittee then to say, okay, hey, how do you want to run this meeting? How do you want to tackle it this year? So I think that last thing I'll throw out, too, is that we're trying to put together sort of a lessons learned or best practices or something like that, so that going forward, those that are new to the committee or subcommittee next year going forward, they'll have something to look at.
That would be nice.
It would be nice. Marilyn was key on that. Yes,
And I
ma'am.
would like to add, I'm sorry. Go ahead.
The format that the information from the assessments, the format that information was given to the TRS was a report, so that no best practice was missed, and so that all of the information for all of the providers was given. So what was developed was a report that had every assessment, every best practice, every compliance issue, and every resolution to that compliance issue. So it wasn't just hit or miss picking Debbie and Lisa's brain. It was in the form of a report that
Right.
covered every assessment on every provider, every best practice, every compliance issue, and every resolution. So they had all the information on all of the agencies.
Thank you.
And I would like to follow up that with as an observer, but a participant observer. What I'd like to comment on is the enormous gift you all gave, Lisa, Carrie, and Debbie, that you provided us with all of the format you've just now talked about. Every word that comes in this packet has come from Carrie. As she moved through those, I mean, here she was, sitting, typing, or it was one or the other. There was always someone taking notes as we went through the meeting. So it was this well-oiled, for me, collaboration. Everyone doing what they needed to do and what we could contribute. So I want to thank the staff particularly, because the quality of our report reflects the quality of your efforts. So thank you. Having said that,
I also want to point out that, anytime you take on a new job and you're at a management or executive level position, it takes, in my experience, it takes at least a good solid year to get your feet underneath you, especially when you have funding cycles and things like that. And Joe has been drinking from the fire hoses, I like to say, since he started, and navigated this process pretty smoothly for somebody who was going through it for the first time. So his guidance to staff and his support of the REC and the TRS has been instrumental in the success of this process. So hats off to you, Joe.
Well, and I actually was looking at this online last night, and so I went through a lot of the questions and the responses, and I was really impressed. Now, having served on the TRS years ago, I didn't feel the need to do it again because I know how long the process is, and I didn't really feel like I had the time to give it. But by the questions, by the responses from the providers, and from also, it is very apparent the detail that you all went through. So as one who's done it before, and for those of you who are on the committee who haven't, I would encourage you to do it sometime while you're involved on the council. You guys did a great job. I'm really impressed with this. I went through it last night, and I feel very comfortable that what you found out is probably the wisest and most comfortable funding that I would be willing to support, because I can see the efforts you guys put into it. This is great.
Thank you.
did a great
I
job.
concur.
Yeah, absolutely.
So what's been prepared here is agenda item 5B. On the back side, it has proposed motion. I think that's where we are at this point then. I mean, pending any questions or discussion on the specific line items or providers and amounts and stuff like that. I think we're at that point then for this motion to be presented to the RAC, correct? Is that right, Joe, you think?
It comes from the subcommittee,
Right.
so
So it's actually, as a committee report to the RAC,
Okay.
it's a motion on the floor.
on the floor.
It needs
Okay, so.
no second, it just needs a vote,
Okay,
unless
this-
there is to be discussion first.
Well, and that's the next point. Is there discussion? Because we've presented it, we've commented on it. None of us have, at this moment, had questions, but that doesn't mean there aren't questions. And we need to entertain those questions. This is not a wash, roll right down the road kind of thing. So questions from points that you'd like to have a little more interested conversation in, that's wonderful.
Who's Next Day Access?
That's,
Oh, okay, I know your face, but okay. Now, you don't know, enough said. I know exactly who you are.
I don't know if that's a good thing or not, Dave.
Other thoughts, questions?
And then Golden Circle Nutrition is a part of Silver Key, so they're not a separate line
Correct.
item.
Correct.
when it comes to the funding.
The Golden Circle program is just a program name.
Yeah, but I remember, like, when I served on the TRS, they were separate entities, and so trying to understand that they're combined, it just.
Silver
looks
Key
separate.
absorbed that program, and for name recognition purposes, they elected not to change the name of the program.
Okay,
So it comes under Silver Key College and Middle School, which is line 42.
thank you, ma'am.
Okay, that's, yeah, I was looking at that going, that's what that is.
And they are rapidly growing, which is why
They serve.
Which is wonderful.
Aisha, the Golden Circle Meal Program used to be under the umbrella of the Housing Authority, and about a year and a half ago, the Housing Authority felt like running a really large nutrition program didn't meet with the Housing Authority mission. So that's when Silver Key came in and took over. And there were some housing activities that Silver Key did that felt like maybe wasn't such a good fit for them, and that went over to the Housing Authority. So they did just a little switcheroo there to make sure that the services that they're both providing are more in line with the mission of the whole organization. Maybe more information than you needed, but.
No,
That's perfect. No, that's important. Are there questions? Yes, Bobby.
I just have an additional comment.
Yes.
On the Teller Senior Coalition Family Caregiver Counseling seat.
Bobby, can't hear you?
And what number is that?
Microphone, Bobby.
On the final page of the comments before the chart starts, there was a question regarding the CPU, Cascade Unit for Caregiver Counseling. And I believe we probably can add the explanation for that. Park County is also covered under the Torres County Caregiver Counseling. And this last year, we didn't have as much happening in Park County for caregiver counseling. But when Teller County covers Park County, it's a little more expensive than their average, with cost per unit staying close to home base. So the numbers may be accurate if we have an increase in Park County coverage this year. Just wanted to make sure people were aware of that. because
Thank you.
Park County connection sometimes gets lost.
Well, thank you, Bobby.
Thank you.
And it's collaborations like that that we love to see.
And encourage, right?
other hands raised or any other comments forthcoming? Are you ready to vote?
Yes.
All those in favor of accepting the TRS's recommendations to forward to the Pikes Peak Council of Governments Board, signify by saying yes.
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 Those opposed? No. No no's. All right. Your report is adopted. Thank you very much for all of your efforts.
Thank you.
Excellent
work.
You guys are the ones who.
That is our big action item. I am just so pleased.
Good day.
We should all just go take a walk around the block.
Did you say you were bringing?
Except for you.
No champagne?
No
Give you a
champagne.
piggyback ride around the block.
9:30 in the morning, I should have thought of
You
that.
should have had
She said
champagne.
the elbow is unrelated. She rolled her ankle on bar.
You're closing, okay. All right. Shall we take a break just because we can, or should we just continue with our information items? What's your pleasure? You want a break, or should we continue with the information items?
No, let's
Continue. Yeah, let's
All right,
continue.
let's go on with the information items then, by popular demand. Our
Thank you.
Pikes Peak Area Council of Government Area Agency on Aging presentation.
And I'm going to, this is going to be really brief because we're going to, if possible, beg out of the actual presentations by folks. We've had some folks out sick and gone. I'm going to give you some basic numbers very quickly, but what we'd like to do is schedule the folks to talk about these individual programs in more depth, possibly at the next meeting or the following meeting. And I apologize for not letting Joe know that ahead of time, but we made kind of a last-minute decision that we couldn't adequately present on these. I will give you some basic information. The telephone reassurance program, which Roma Costanza runs, basically a lot of folks know that as a Lifeline program. I know in Teller County it's not, in Teller and Park counties it's not Lifeline, it's a different company. But those are the pendants that people use. We currently have roughly 322 folks on that program. That is one, as a bang for the buck program, that's one of the best programs we have in terms of doing what the mission of the AAA is, which is to assist people in staying independent in their own homes. And it gives a huge amount of reassurance. I think that's why it's called reassurance program. Huge amount of reassurance to families who know that if something happens, there's emergency response available. The Homemaker program, which we run through the internal program of the Area Agency on Aging, is a voucher program where we provide those vouchers to individual Class B home care providers, and actually we provide them to the client. The client gets to choose their provider, and when they do that, the provider will monthly send us an invoice, if you will, a copy of that voucher, and we pay those out. So it's what they call a directed program, a client-directed program, which is a huge focus of the state and the country in terms of making sure that the consumer is a vital part of the process of making that choice. So it's a great program as well. We serve roughly 42 people right now in that program, 42 individuals, with about 1,750 hours of service to those folks. And if anybody wants these numbers, I'm happy to provide them to them. We do have a really good accounting of these on a monthly basis. Also involved in that program, very similar, it's kind of a companion program, is a personal care program. The Homemaker program is basically for light housekeeping, helping folks arrange the house, light cooking, that type of thing. There's also a personal care program that's the companion piece that requires a little bit higher certification from the home care company, and usually involves bathing, anything that's a hands-on service. So if it involves touching the client, then for lack of a better term, it's considered personal care. We have 16 individual clients in that with about 416 hours in that area. Obviously, that's just a small snapshot of the programming. We will get better idea of what we do internally. We want to give you the full picture of what our internal programs are. And we actually have visions of next year, when Joe's been here a little bit longer, possibly doing the RFP process, a mini version of the RFP process for our internal programs as well. So that we want to make sure they're justified just as much as the programs that the folks in the community provide. And our information and assistance program, I don't have the exact stats on those, but for those of you that don't know what that is, that's predominantly the 2096 number, 471-2096, where we answer a huge number of questions from the community relative to, thank you. Oh, I have the full report, sorry, on that one. 132,080 responses to calls and or emails or whatever walk-ins came in. That's one of our most vital functions. And I look forward to actually having a presentation on that, probably from Lucy Jacobs or Lisa Hiedla in the future. Any questions I can answer on the short term?
No, I'd just like to mention that came up in the, as we looked at the overall numbers, we saw that the AAA was receiving funds as well. So that was a question or suggestion that we get the staff then to provide those briefings. So we get, from a RAC perspective across the counties, we understand, okay, so what is the AAA doing in addition to all the providers? Just so that we all have that firm understanding, so we can tell our constituents and our neighbors and everything else, this is what the AAA is doing in the area.
Sure. And I think it's a two-pronged effort. It's not only to provide as many services as we can for the amount of dollars we have, but at the same time to make sure that those services are not duplicating what somebody else in the community is doing already very well. So that's kind of the process over the next year.
Or if in fact we need all of the services we can get, and we still have unmet needs.
Right.
Although when I say that, it's really hard to say we have a waiting list and you're on a waiting list for 2 years to have the help that you need right now. So I don't want you to misinterpret what I'm saying. What is the unmet need? There are more ways of determining that besides what is a waiting list. That's just a philosophical comment from me, and I didn't want that to go unnoted. Because in aging, you can wait 2 years and then you certainly won't need the services. Enough said. Thank
Should we
you.
carry on with the next one?
Yes, please do. Go right ahead.
From the director's report standpoint, the bigger global issues and local issues, it was actually a fairly slow month. The one thing I did want to note, the State Unit on Aging has released some preliminary guidelines, which I believe go into effect on July 1, relative to nutrition programs, and it's a huge step forward. People who go to congregate meal programs will now be able to take their leftovers home with them.
That is huge.
It's a pretty huge thing. And in addition to that, there will be the capability of folks who are sick or can't get into the meal site to have someone pick up their meal and take it out as a takeout meal. That's awesome.
Nice.
Can I add something to that, Joe?
Sure.
A lot of these meal sites in Colorado Springs are actually based in Colorado Springs Housing Authority buildings, and the regulations used to prevent somebody who was too ill to come down from an upper floor in the same building from having a meal walked up the stairs to them by one of their friends who knew that they were sick. So this is huge for the people who are the most vulnerable and who live in, not all the meal sites are located that way. For instance, the senior center isn't like that, but for the buildings where these meal sites are located, the residents being able to have a meal taken to them is huge. It's a big change.
Well, I've been doing a sponsorship with Silver Key, something I've been doing for years, but now it's more formal, where I've been going in and doing presentations at all the different meal sites. So I've been in probably half of them already just the last couple of months. And it really is discouraging to see some of the food that's wasted. And I know that Silver Key has been really frustrated with that too, trying to figure out a way to, why is no one eating the pieces of bread? Is there a reason? Is it just too much, or what is it? So this is a huge opportunity because that will really decrease the amount of food that's thrown out. But then hopefully they can take that piece of bread home to their apartment or wherever they're at, and then be able to use it for toast the next morning. So really, that is an amazing change that will really make a huge difference. Just like Carrie said, in a lot of those buildings, I have personally witnessed people sneak food out of the dining room to go take it to their friends in their apartments. So this will be a really a huge boost in how, and the growth of the program. So if someone's not actually physically coming down to eat, that won't eliminate them from being able to participate. So I expect that the programs are going to really increase as far as who will access it. So more money next year for Silver Key.
When will that be announced?
We think that it's, actually, they have announced that the tentative start date, I believe, is July 1. And it is, I would throw one caveat in there. We're talking about state and federal programming, so this doesn't come without a bunch of rules hooked to it. So
What doesn't?
Where the problem, I mean.
People will have to, some of the rules are health department rules. They'll have to be, the to-go container has to be provided by the meal site. You can't bring your own to-go container. It has to be dated at the time that it leaves the facility. If it's a pickup meal, it has to be signed for by the person that took it and signed for by the person that receives it when they come back. So there's some red tape associated, but we're willing to wade through that just to make the program better. And on that same vein, I might talk real briefly about, I think we may have talked earlier in a previous meeting about the NIFISH program that Silver Key and Golden Circle participated in. The site that they used was the Colorado Springs Senior Center because I think that's their biggest site. They received a grant to study waste, basically, and it involves some equipment, very good equipment. Sorry for the technical challenges. And bottom line, for a period of time, those folks that ate at that meal site separated everything when they got done with their meal. So it either went into the vegetables, it went into the entrees, it went into the fruit section. And it was very, very knowledgeable. They also measured what they call pan waste, which is how much food was made in the kitchen that was never actually never served to an individual. Very, very enlightening. It was a great process, and I think they learned a lot. Probably the main takeaway I got, we were able to attend, Lisa and I were able to attend the session that they did on the follow-up, and the main takeaway was that seniors are not a whole lot different than fifth graders. They do not eat their vegetables, and they don't like black beans. We learned a few other things, but that in conjunction with the efforts that Silver Key has already started in terms of improving the quality and the edibility of the meals that come out, I think you're going to see some good changes in customer satisfaction over the course of the next few years. Couple big summits coming up that we will be attending as a group. Predominantly Carrie or I or Lisa or somebody from this organization will be going to. There is an ADRC summit, which Aging and Disability Resources for Colorado is what that stands for. That will be held on June the 13th and 14th up in Denver. That is a state unit on aging summit to talk about ways to improve those programs. For those of you that don't remember or know what ADRC is, it's a federally mandated program to serve people of all ages with regard to access to resources. It's the simplest way I can put it. And it is commonly thought that program will eventually evolve into what's called the no wrong door concept, or the two work very closely together is a better way to put it. So the state unit is doing that, while at the same time HICPUF is doing the no wrong door pilot programs. There's also an age-friendly summit. It's basically an extension of what has happened with the Colorado Springs program. I think that's the timing that spurred that on. Colorado Springs has 3 cities that have been designated age-friendly: Fort Collins, Colorado Springs, and Denver. Denver probably being the furthest ahead in that process. This particular summit brings in folks from a lot of those other cities that have already done that to see, we're at this point in time, what can we learn from these folks that have been doing this for a year and a half or longer. As far as a legislative wrap-up, I don't think there's a heck of a lot to talk about. The legislative session this year was very, very interesting. There were not a lot of senior bills. I think you can expect the exact opposite of that next year. Claire's work and the other 23 people that are on the SAPCA Strategic Aging Planning Group will be done in November. Their final report is due to the governor by November. And so we anticipate that the next legislative session next year will probably contain some action items relative to that. There wasn't a heck of a lot, and which is good because there was no money. So
I will jump in and say that at that very podium in this very room on Friday, Governor Hickenlooper signed a bill into law. And if you grew up with Schoolhouse Rock and you know the song, you know that a bill becomes a law when it's signed. And I have to say it was a very, first of all, he shook my hand, which was totally awesome. But it was really, for me, it was a powerful experience to watch what was a bunch of papers become legislated onto the books. It's now statute. It now applies across the state. And it just so that you know, it was a piece of legislation that was veteran-specific. And the idea is that as members of the active duty military are discharged, that they can translate their training within the military into civilian credentials without having to start all over. So if you were a medic, you can then perhaps move on to become a CNA without additional education. So it was a very good one. And he was in town signing a bunch of stuff. But it's really a very powerful thing. And tracking it all the way from the beginning of the year, as some people did, I'm sure for them it was even more meaningful. But it's nice to see us having a role, even if all we're doing is being a partner agency to the Peak Military Care Network and letting them come in here and have their event in our building. But it was pretty cool. So that was one of the last things in the legislative session, I would imagine, was signing everything.
And I would also add there is one kind of somewhat personal connection to the Pikes Peak region. One of those bills that was signed last Friday was a bill that was impacted a lot by the local paratransit entities, in particular AmblCab. Gail Nels went to the state and testified relative to that bill, and what it did was release certain paratransit providers from PUC requirements, Public Utility Commission requirements, which are quite onerous. Gail had just gone through the process of getting a PUC license. The bottom line is, if you're somebody who provides only transportation to folks from a specialized standpoint, then you have to go through the PUC process. If you have some side business that does, let's say, a little bit of home care, you didn't have to go through the PUC process. So they basically made that process a lot simpler for those folks that are doing some really hard work right now and probably don't need to go through all the stuff that the Colorado Springs City Transit folks have to go through with regard to their bus programs. Any questions on legislation? Great. The one last thing I would say real quickly is the Area Agency on Aging is going through a process right now of working with one of our software providers. Chocolate is the name of the company. They provide us with a real important piece of software for monitoring, actually doing our AP, for our accounts payable, for lack of a better term. We are the pilot site for a program that allows us to automatically upload that information to the state into their system. And without taking a 2-hour class, I will tell you that basically when we report on a local level, we report our information and we send our checks out by provider. So Teller Senior Coalition, Park County, whoever that is that asks for a reimbursement, we send that to them. The state wants that information organized by program. What is congregate meals? What is home delivered meals? What is case management? So this piece of software will hopefully convert that, and we won't have to do this manual entry process that Debbie has to go through every month. Hopefully save us a good amount of time. At the same time, they are helping us with our voucher program to automate that so that the providers the Class B home care providers who provide voucher assistance for caregiver respite, homemaker, personal care, will be able to get online and file all the reimbursements themselves, as opposed to a somewhat archaic process we have right now. Lisa?
Only for our internal voucher program?
I'm sorry, yeah, right. The internal programs. So any questions on that? Any questions for me in general? Thank you.
Fantastic work.
Thank you.
Well, thank you. That was a very informative, as you said, brief report, but you had a lot in there.
I can be brief occasionally.
You did well.
Brief, maybe, but no. This is just a way of saying how many parts of our community, our state, our nation are involved in this room as we represent our community and our people. So I think it was wonderful to be able to see that. And I didn't realize the impact of the governor's signing. I'm just envisioning him signing bills in this room, and I'm thinking, wow, that's really impressive when you think about when we say the Colorado government happens in Denver. And this time, the final process happened in this room for a small portion of that. And I think that's really, really, really nice to recognize. Thanks, Carrie, for that additional information. Appreciate it, because it was meaningful to me. And I particularly like the fact that the CNAs the medics whom I adore when I was in the military, they saved me personally many times. Any of you who've been in the military or have family members who are in the military know what that means, because they were my backbone. And if you have the support of your whole team, everybody works together. That happens in the military, it happens here, and I'm glad we could recognize their service and their knowledge and their skill in our civilian areas. So I'm particularly pleased. Thank you for sharing more of that, Carrie.
Don't they fill a need here, too? That category is going to fill a need here where it's difficult to get people to come in.
Absolutely, it's
Definitely need
huge.
CNAs in this community.
Yes, and their skill is enormous. So anybody who has a heart for that needs to be boosted and recognized. So thank you very much for those. Are there other community information from the
Senior resource?
RAC members and from the group at large?
Cheryl had something.
Who?
I have
Cheryl.
something. Just so everyone can hear me. I think Carrie sent this out already, but I just wanted everyone to know that on June 14th, the El Paso County Board of County Commissioners will be reading a proclamation on elder abuse awareness and prevention. And I think that that's just so important that they're going to be reading that proclamation and bringing this to light. So again, that's June 14th.
5 days.
And it's at Centennial Hall. The Board of County Commissioners meeting starts at 9 a.m. Usually proclamations are read, between 9 and 9:45, but sometimes not. So I just want to make sure people know that sometimes it might take later, but just a really, really important thing. And, it's so valuable to bring awareness to this very valuable population and vulnerable population. And so if anyone has an opportunity to come and show your support, please do.
And I will add, I've been to a proclamation reading before, and those meetings, I think when there's a crowd that's there specifically for one of those things, it draws attention to our elected officials that this is of value and importance to our community. So I echo Cheryl's sentiment. The more bodies that we can put in that room specifically for that proclamation reading, I think the better.
Absolutely. Thank you.
Will you resend that out?
Yes, I will resend
June
that.
14th.
So how do they know who's there for what bill? Do we all scream and yell?
Because after they'll ask you to read, everyone gets up and walks out. That's part of it, actually. Yeah. But actually, they'll ask people to stand. They'll even ask if anyone wants to make a comment on the proclamation or if they have anything they'd like to share. And then a lot of times they'll do a photo opportunity and, a nice picture of everybody who came to support this particular proclamation. So it's
Cheryl,
very nice.
would you just give us a little bit more background as what was the process of bringing this proclamation to the county commissioners?
So one of the things that the Department of Human Services does is several times a year, we look at the beginning of each year of issues in particular that we want to bring to light. And there are so many, so we would be bombarding the Board of County Commissioners if we did everything that we thought was important. But we kind of strategically look each year about what proclamations we want to bring forward. And so our public information person sits down with us, and this year she sat down with me on this particular one, and she writes the proclamation to present to the board, and they then schedule a time. June is also Elder Abuse Awareness Month, so the proclamation coincides with that nationwide date. So,
and where will the proclamation be published? Do you have any idea what's the next step for that?
wow, I don't know the answer to that. Do you, Fran?
It will be on the county website. If you go to the BOC agenda and click on the item on the agenda that you have showing up on your computer, it will take you to the attachment, which will be the proclamation. So you'll be able to read it and even print it off your computer if you choose to.
So I learned something new.
The only thing is that it will not have the signatures of the commissioners when you see it on your computer screens, but because the proclamation is signed, or that will be available after the meeting.
And is the press usually there to cover that? Or
They're invited.
They're invited, okay.
The Public Information Office, the County Public Information Office, will issue a press release along with the pictures of those that were supporting it. So that will be given to all the news media. So it very definitely is a in our favor, so to speak, that if you are able to attend and be included in the picture, it just shows better to the press. So
absolutely.
And if the AAA, the RAC, had an opportunity to say a few words, I think would mean a lot as well. You represent such a large segment of this community,
Definitely.
and
Definitely. Okay, thank you for that added information, because it's important to know what is the public impact of what we are doing, and here's a wonderful opportunity that is a difficult topic. We don't like to talk about it. It's here with us all the time.
and we need to talk about
And we need to talk about it, and the way we address it is by care and attention and focus. So thank you for helping me understand that better.
And I might add, I think that Colorado Springs has long been held, at the state meetings I attend, Colorado Springs is held up in very, very high regard with regard to how Cheryl's department, how DHS, how CSPD, and how the community in general all cooperate so eagerly in the investigation of elder abuse, and aggressively as well as fairly. And so it's a good thing for us to hold up, because we're a good example.
And just for your guys' information, because this will come out as part of the proclamation potentially, is that El Paso County has the largest number of reports of abuse and neglect of any county in the state of Colorado. Now, that doesn't necessarily mean that there are more instances of abuse or neglect in our county. What that can mean is that more people are aware of the need to report, and we've done a really good job in terms of outreach, working with our partners, working with law enforcement to make sure that things are reported, even if you think, you're at home and you're just thinking about your neighbor and you're thinking, do I or don't I? The answer is always yes, you do, because we want to report, even if it ends up being nothing. That's a good day for us. And so, there's a lot of reports that we get, but again, part of that is because of the work we've done in the community in terms of
And
outreach.
this is the way we build our collaborative response.
Absolutely.
Collaborative, the community as a whole, collaborative response. Thank you. Ms. Aisha.
On a much lighter note, on behalf of the membership committee, it is getting to be that time for us to start looking around to find replacements for those of us who will be leaving after 6 years. Tears. Or those vacancies. Yeah. But, and those vacancies that we already have. So if you have people in mind, please encourage them to come to the meetings or even just submit an application. Since this is our summer and we're going to the outlying areas, Park and Teller County, please invite them to come to the meetings since we'll be out in your area, and encourage them to apply as well so that we have balanced representation of all of the counties that we serve. So.
Aisha, who do you currently need? What positions are open that you need to fill?
Well, I think we have 4 vacancies.
I just emailed Carrie about getting a more firm grip on who's leaving, how many we have open, and so we'll have a better idea of that.
Good.
As far as what we'll need as the committee. I know that having been involved in the membership for a long time, it's always from those who are on the council who find those who are interested that are the most qualified and appropriate people to be on the council. So, and those who are providers as well. So if you know of people, that's always the best outlet for us to be able to find new people is by those who already understand, and you can explain to them what the expectations are.
You can put anybody that you want to in touch with me, and I can be the funnel to get them to the membership subcommittee members. And I can send them, as Carol Parks knows, I can send them a membership application electronically, and then they can fill it out.
Thank you.
And I would also like to say to the members of our audience, I know that many of you represent our provider agencies. However, you know people too, lots of them. And those members in your communities, your particular areas of influence are the people who really care about aging in our community, and the family members, the caregivers, all of the aspects of aging in our community. And as you see, we want to really encourage this broad area of support. The only way we can do that is to have members that represent a broad spectrum of our community, because we all had parents, have parents, will be parents, and that is impacting on us as our broader Pikes Peak region. So please, consider yourself a particularly invited member to find new membership for our community. Carrie, you have a thought?
Not related to membership, but before we meet next will be the Successful Aging Expo.
Yes.
Saturday, June 4, at the Marriott up on the hill in Rock Rimmon. Co-sponsored this year, not just run by the Senior Resource Council, but co-sponsored by the Gazette, which I think this is the second year of that particular partnership. And the Area Agency on Aging will be represented there. We have a table, and we'll be handing out yellow books and information. If you attend, please feel free to stop by and say hello. But refer any seniors that you know, or service providers or professionals that serve seniors, to attend the expo if they don't know about it. It's hard for me to imagine there are too many people in Colorado Springs in that community that don't know about the expo, but there's always a first time.
One thing that the name has changed a few times, and so making sure that people know that the Senior Expo, Boomer and Beyond Expo, Successful Aging, all the same thing. This is the first time it's been this far north.
Right.
So we're a little curious about some of the attendance maybe from more of the center of town, and if we can still pull some of those, the residents that live in those areas. I assume we can, but still, it'll be interesting to see about that. But it is 8 a.m. to 2 p.m. So if anyone has someone, so up at the Marriott, again, at the top of the hill there off of Rock Rimmon Boulevard, 8 to 2.
I'm sorry, what day again?
Saturday, the 4th of June.
Yeah, soon.
Do they have a shuttle bus to take people from the bottom of the hill?
Well, no, because you'll park. I mean, you'll be parking
Well, I
at the
meant if
top,
people
yeah.
rode bus, or they
Well, the bus will, yeah, no, the bus will drop them off at the entrance, but no, I think it'll be fine. So parking is on the top of the hill, but you can see the hotel. I mean, it's very, very distinctive sitting there up on the hill.
Oh, yeah.
So,
Very much so. Is there any effort to be working with, like, the Fountain Senior Center or even the Colorado Springs Senior Center to get maybe a van or a bus of
I am
seniors
no
going up
longer
there?
the chairman of that event, so I would say, I don't know.
Francis, traditionally, they are pretty actively involved in that.
Yeah.
I don't know about this specific one, but in the past, they have been actively involved.
Let's encourage.
So I just have a little something to say, because last Friday, well, Carrie was in awe of Hickenlooper. Mr. Joe Urban was the MC of the centenarian celebration in Durango.
Yes, he was.
I just have to mention that, because not only was Joe a great MC, but it was just a fabulous day. And the Colorado Commission on Aging, which Joe sits on, along with Jody Barker from the Senior Center, did such a great job honoring 10 centenarians, all from the Durango area. My cheeks hurt on the way home from that 6-hour drive on the way home, because it was such a great celebration of life. You guys did such a good job telling us their stories. I mean, I had tears in my eyes. I laughed, I cried, it became a part of me. It was the greatest, one of the greatest events I've been to in a long time.
That's
So,
awesome.
That's fantastic.
thank you to the commission.
And in particular, thanks to the local senior center there that's run by a woman by the name of Sheila Casey, who used to be a commission member. Man, they did some great prep work for that.
They put on a great show. It was my cheeks
Well, they'll
still
be-
And
remember
how
much
many
I
people
smiled
got
that
to
day.
100 years?
10.
There was 10 of them that were at least 100 or older. There were several of them. Most of them, I feel like, were more than 100.
We
Yeah,
have
there was-
something to aspire to.
There were several. There was only actually one, I think, out of the entire bunch that was celebrating a 100th birthday. Everybody else was either 101 or 102.
And you'd be amazed. I mean, some of them were in the audience correcting, the folks talking about them. And I mean, they were with it. They knew why they were there. One of the fellows got up and recited like a anecdotal poem about leading your horse to water. I mean, it was the greatest thing ever. And to see that kind of life at 102, I mean, it was awesome.
Oh, we got a long way to go, babies.
That's right.
Thank you.
Yes,
You
I
didn't
appreciate
mention
knowing
in
that.
your little report, did you?
Forgot.
Joe, are they going to be doing any of those celebrations up in this area?
Yeah, the process, very briefly, is that we rotate those around at
That's
different
what I thought.
places in the state. It was in Colorado Springs 4 years ago, so it'll probably be, my guess, another 3 to 4 years, probably 3 years before it comes back here, because we do bounce to every corner of the state. And unfortunately, you have to turn 100 at the right time or be willing to travel a ways to be involved with that. However, for those of you that don't know, the commission presents certificates to anybody that turns 100 wherever they are. So Jody Barker and I got to go over to the Bridge Assisted Living about 3 months ago and present certificates to 6 people at the same time in one 50-unit assisted living. So if anybody doesn't think our longevity is increasing, they should go over there and take a look around. And these were active people. I mean, 1 or 2 fairly frail people, but basically, a lot of these folks are very, very active.
That's wonderful.
That was my greatest surprise. I mean, I pictured, a lot more gorked folks sitting there, and because most of them were interacting, and so one gal had a shirt that said, "It took me 100 years to look this good."
Oh, wow. I love that.
Yeah, very full
I'll have that
full of life.
That's what we all aspire to.
Exactly.
Yeah, that kind of vigor, yes. Definitely.
One local note, too, for the northern El Paso County area. A couple meetings ago, I think I announced that there was a new senior residence that was coming up in the Monument area. That's Bethesda Gardens. It was $13 million, and they have groundbreaking. It should be next month, within June, mid-June. And it's a 60-apartment assisted living and memory care. And just announced, there's an article we just put out in the local Tribune, there's another senior residence that is just announced. It's $27 million, so it's double the size of the Bethesda Garden one. This is going in on Jackson Creek. It's going to be a Class A or luxury type of senior living. It'll have independent, assisted, and memory care. $27 million, 131 apartments. and that's going to have groundbreaking, expected groundbreaking is in November. So both of these within either the end of 2017 or January 2018, both of these units will be open. So that'll be 190 apartments approximately that'll be available for seniors in the Monument Tri-Lakes area, northern El Paso County.
For the very wealthy seniors. Do they have any plans for comparable affordable buildings being going in?
No.
Bethesda owns 2 other buildings here in town. They're Viewpoint and Broadmoor Court.
Right.
So they do take Medicaid, whether that building is going to or not, but they're not unfamiliar with the needs of the community in town.
That's encouraging to hear.
Yeah, Bethesda's a national one.
Yeah, and they are national, and they actually do some good work, Bethesda does, with some children in third world countries. So a lot of their senior housing funds, some of their mission work in third world countries with children. So, there's some good things done.
That philosophy is admirable, but when I hear about the very high number of apartments that are going in, senior housing that are going in for the very wealthy, who very quickly become the very poor, and add to this already huge number of our near poverty and just above and quickly becoming poverty seniors. So I'm always encouraged to hear what's happening at the high level, but it's important that we keep our eye on this larger number of seniors that do not have the good fortune of having money enough to serve those.
Just to piggyback on what you're saying, I think it's important to note, too, that both of those organizations, one's a private business, if you will, Greenwood Partners out of Denver, and then Bethesda, which is a nonprofit, which is having the senior residents focus as well. Both of them have done multiple marketing studies that look at the demographics on the north end of the county within so many miles, 15, 20-mile radius, whatever, and all the rest of it. So they've got the hard data on it. That's somewhat different, I think, than what about the need for those that really can't afford that are more on that hard economic times.
Right.
Where's the data that supports that? The community doesn't have it. Monument, Palmer Lake. I don't know if the county commissioners have that information or the county social services.
That's a really important
But that's the hard data that's needed. Then we, from an organization perspective, or from the nonprofit providers, can go to the towns and the cities and the county and saying, hey, something needs to change here. You need to be focusing on this unmet need. That's the hard part.
Well,
the hard data's not there.
One thing I would add to that, though, is that having looked at the North End, Dave and I have talked about this a long time, about the viability of having a PACE-like program in that area. That potentially could work if they were really dedicated to want to stay in their home. Because in that area, they built a home 30, 40 years ago. It's increased in value, but they can't afford to have the home. With their income, they can't afford to keep up the house. But here's what's interesting. In that area, if they were to move into one of these buildings, the assets they would then have, because they'd have to sell their house, would prevent them from being able to get any assistance. So what I love about it is that regardless of whether or not it's affordable housing, it does provide an opportunity for those who, once they do choose to move out of their home, sell that property in Palmer Lake that's going to have a pretty good value, they're going to be able to stay in their neighborhood.
Exactly.
Instead of having to move out and come farther into town. I love that. But because they would be choosing to leave their home, then that home is going to become an asset, which it may not have been up until then for them. But at that point it would be, and they would be eliminated from being able to come to any other affordable kind of housing because the value of their home that they've been in for 30 or 40 years, whether it's the home or the property, has increased so greatly that they're looking at, get $400,000 to $500,000 that they're going to have to spend down. So, but that's exciting because they can stay in their neighborhood.
Right.
That's wonderful.
It's going to just help even everything out. So all the people that really don't want to live in Colorado Springs that can now go north and get back to where they want to be, then it opens up. It's just
Yeah, it will. It will be great. Yeah, that's a very exciting thing.
And I think these are the kinds of developments and progress, situations in our community that are very nicely opened up in this kind of a forum, because we have a broader perspective from all of our various areas. Needs of housing and that's in the age-friendly. I wish that Claire and Emma were here to hear this spirited comment and collaboration of coming together with all of our various perspectives and knowledge base. I think it's wonderful. So thank you for bringing it, and thank you for joining in the conversation.
Just to continue it one step further would be the affordable housing across the region. I don't have any data on that at all. What exists, what's being considered, what's planned, what initiatives are coming from governmental agencies to stimulate this, what the developers are, those that are already providing that or are participating in affordable housing. That, again, would probably be worthwhile for us as the council to really understand, wow, I didn't know that there is some in the south part of Colorado Springs. There isn't anything in Teller County, or there is. I have no idea.
Right.
So I'm sort of central in my
Yes.
geographic.
And Dave, I would be happy to do a little research on that maybe and bring it to the next meeting.
Yeah.
I know there's a new HUD property that has just opened or is getting ready to open up around Vickers and Academy-ish area by the East Library. Other than that, I don't know if there's anything else on the plans, but I'd be happy to do some research and bring that in. I did want to note that Bethesda their national headquarters is on Baptist Road.
Yeah.
So they're a local company.
Yeah, great CEO, too.
A couple of years ago, at my request, one of our GIS staff members who works upstairs in transportation, when they had a little bit of time in their schedule, put together a map of all of the long-term care facilities in the region. And I suppose it's a possibility, once we have an updated set of data points, to ask for that map to be regenerated. You what?
I might have that. I might have a map that. I'll look.
Okay.
And
Down the road, and this won't affect anything right now, but in Alexandria, Virginia, where I lived, every apartments that were built had to have a certain percentage for low income. I was really surprised.
That's a great idea.
It was expensive ones as well as whatever. I lived in an expensive one.
There you go.
But it was subsidized by the city.
And a
Well,
lot
and HUD does that too for builders who are willing to build
Exactly.
apartments that will have 30% of them
Certain set
being
aside.
affordable, and the remaining
Is that it?
70% are market rate. And the reason that traditionally HUD or the feds have put those kinds of dollars in is to spread out your population of people who maybe are low income, so they're not isolated to a particular affordable housing unit, and they're spread throughout your community. So, but
That's
it's
good.
up to the builders whether they want to go with that type of
Because
investment.
there are a lot of strings attached to that federal money.
I believe so, yeah.
Yeah, I would expect so.
Why have to reserve apartments that you're not going to get paid as much on when you can, when you don't have to?
Yeah.
It's hard. It's a tough one.
That was one of the issues with age-friendly Colorado Springs housing.
Thank you. I was just waiting to say that. Thank you.
That was one of their recommendations, that be spurred.
Yes, that's one of their areas of concern, because it is a part of age-friendly, just as there are eight areas?
Eight domains.
Eight domains.
Yep,
domains.
absolutely.
And so housing is one of those domains. So we are now entering into a wonderful community dialogue that supports that domain. Okay?
And that is, none of this is lost on the state. I believe there were two bills that would have either directly or indirectly affected affordable senior housing. One of them just affected multi-unit complexes in general, and both of them had fiscal notes this year, so they died a quick death because they cost money.
Yeah.
Right, no money behind it means no point.
Yeah, and I would like to say, just in the point of Margaret's position where she is, you are living in a,
Low-income senior community.
and how long has it been in this community?
Oh, over 100 years.
Yes. Is this a new problem, a new concern?
No.
Absolutely not. And who was your benefactor?
Mr. Stratton.
Meyer and Stratton.
No, actually
No.
Winfield Scott Stratton.
Yes.
Winfield Scott.
And it was
Sorry, it
named
was
for
named
his
after,
father
sorry,
as a
named after his dad,
generational-
yep.
As a generational gift to his father, he named his foundation and his project for his father, who is that generational thing of aging. So this is something that is very strong in our community, caring for those who do not have.
Oh, I know.
And so those who do have the responsibility of caring for those who don't, as a community, okay? I'm talking broadly.
We currently have 84 independent living apartments and 25 assisted living beds, and they're currently looking to maybe expand a little bit more in the area there on the grounds. And then I also heard that the old Sunny Vista building is going to be probably our biggest competitor here soon, because they're going to redo that building for assisted living.
And that also has deep roots in our
Yeah.
community through General Palmer
Yeah.
and family.
Do you have the book on, the bio on Myron Stratton?
We have some at
The
Yeah.
reason I'm asking is Pikes Peak Library District created one, and I have a couple of copies. Okay.
And there was
You
one,
got more use for it than I do.
somebody, other hand?
Yeah, it's amazing to me that they go north, they go south, and they go west, but they never go east. There's absolutely nothing east.
Well, how novel that you should
I-
suggest. You've upheld your role.
Well, you know, they don't
It's
have,
true.
they have.
It's true.
It is true. And they have absolutely nothing out there. If you want to go to a nursing home, you go to Hugo.
Yeah.
You know, I
Fancy
don't
that,
think
Hugo.
that Falcon and Callahan has a senior place to live. And Patty Jolly is out there with the senior center. And it's just, and Falcon, there's just absolutely nothing out east. Any way you look at it, and
I would say something positive that I think a direction is that if we can show builders and communities that there is a viable funding available and that there are people who need it. We, not just this monument, we've also just recently had a rehab and assisted going up into Teller County, right over there by the hospital. So what I get excited about that because that tells me that they are looking around. And if that can be successful in Monument, if the one up there can be successful in Woodland Park, then the next is to be able to show that, and they can see, look, if we do something right there near Falcon, it's going to bring in all those people around. But until you can see the advantages, until those who are at the building can be shown and proven that this is going to be something that they can get the money back because somebody has to build it, that to me is exciting that we see these things happening in other areas because then we can start pushing for the ones that still actually do need it. But if that doesn't happen anywhere else, facts are Falcon is not going to be the first choice. But if these other ones are successful, then perhaps we can start pushing for some of those other areas.
And that
There you go.
need that is, that we're speaking to here in the East El Paso County, Keller, and Park County. Also.
Exactly.
Now, that doesn't mean that one solution fits all people, right? There is.
It's positive.
But the need of housing fits all of us. If we're still alive and not 6 feet under, then we need housing, right?
More than a
Touche.
tent.
Huh?
More than a tent.
Please.
More than a 10. Okay, I think we've spent plenty of time on this issue, but how nice to have this broad perspective. Thank you. Our next RAC meeting is June the 30th, here in this,
No, not here. We're going to be in a remote location.
There you go.
Pack a GPS device and a snack.
an adventure.
Yes, and I will get that secured by the end of next week. I do want to point out that in July, Joe and Lisa and I will all be gone on the day of the regularly scheduled RAC meeting. And so we're looking at an earlier date in the month, possibly Wednesday, the 20th, if that's the right
That'll work for me.
So I will send that out. I will send out an announcement with both the meeting location for June and the date and meeting location for July together as soon as I can so that you can schedule those or calendar them.
So start, make big plans, because we're not going to.
My son gets married on the 29th, so the 20th would be much better.
Oh, well, we're glad we arranged that.
I've got a road
I
trip.
appreciate that.
Vacation.
Oh, just one more public comment that doesn't require a lot of discussion, but I know the fairs are coming up, so next month, are we going to talk about the different fairs and stuff?
Unless we're doing rural outreach as a project, which we have done in the past but haven't undertaken this year, we are committed to the El Paso County Fair, and Fran is our avenue to getting volunteers signed up. She'll send me the spreadsheet when she has access to it, and I'll distribute it electronically and ask people or I will ask for people to volunteer, and we'll circle back.
How many days is that?
The fair is 8 days, 9 days, and we typically try to help staff the El Paso County booth for the entirety of Senior Day.
Which
And-
is usually a Friday.
And any other days that people want to jump in. We put staff members in the booth and we put RAC members in the booth, and you get to sit there and meet people who work for the county, which is often entertaining, because you hear stories about behind-the-scenes stuff, and then to speak with the seniors and to hand out our resources. And, there's often you're who, you're what, so.
Yes, and I'll have more information and more details about that at our next meeting.
Great. Thank you.
Thank you all. Thank you all. Is there a motion to adjourn?
Make a motion to adjourn.
Lots of motions
I second.
and multiple seconds. All in favor? Favor. Aye.
Thank you.
Thank
Well, that
you.
was really good.
Wonderful seeing everyone.
We appreciate your contribution, discussion. Excellent. Thank you, Joe. Excellent. Oh, well, when